Hello, everyone, and welcome to another episode of I Am Christina DiArcangelo. And I have a familiar guest and friend and face today on the show, Tiffany Watkins. Thank you so much for joining us today, Tiff.
Thank you for having me back on. I always love my time. I always enjoy our conversations.
It's always fun. We always have a good time when we talk. And so today, we are talking about, I feel like every one of our topics are important, but as we are gearing up for May at the end of April here, we are gearing up for Mental Health Awareness Month, as well as a focus on opioid abuse as it relates to mental health, because unfortunately, a lot of people that abuse opiates are mental health patients that are trying to seek solace in being able to have opiates. And so today, that is what we're going to talk about. So thank you so much, Tiff, for joining me. Just for our viewers and listeners out there, as a reminder, Tiffany sits on the board for Affinity Patient Advocacy, as well as the fact that she's been promoted to the executive leadership team and is now a vice president of the board. So we're coming to you from the APA angle today, from the executive board angle, to talk about this very important topic today. Tiff, would you like to kick it off?
Sure, I'm happy to. And thanks again for this conversation. It's so important that more people have these types of talks, and hopefully our conversation will spark that for them. You're right. Opioids sit at the top of addiction, overdoses, death, but mental health is inserted in there at so many different points. Look, people get in pain. People have chronic illnesses, chronic pain. Pain alone can put people deep into depression. So without any medication at all, people are dipping into the lowest states they've been in their life just because they are in just ailment, and that ailment is bringing them lots of pain. And then, they get prescribed medications to take. I don't believe these people set out. The average person doesn't set out to become addicted to a medication, to be reliant upon it for their very well-being, so they can open up their eyes every morning, so they can step out of bed every day. So it's like one of those unfortunate happenstances, right? So what we really want to bring awareness to is the fact that the cycle starts from a very innocuous place. It is very much so. I just need something for my pain, and then they get prescribed something, and that medication is so heavy, so the body becomes reliant upon it almost immediately, and then they get caught in the cycle. I don't want to hurt. I don't want to feel bad, and so they're using the medication to treat the pain, but then suddenly they use the medication to just feel good, to just alive. And that is where the problem is. This is what we need to figure out, a pathway for folks to be able to manage pain without becoming addicted to opioids and other medications. I think that's a point right there for us to dive in.
I agree with you completely. Especially since, as you know, we were all working on the diabetic neuropathy study through Affinity Bio Partners, Spectral, and Affinity Patient Advocacy. And so we heard it first from the patients' mouths. This was a DN study, but the underlying affect, if you will, for these patients are pain. So these are really, really sick individuals that are ridden with pain. And so, of course, they're going to be anxious and depressed because they can't get down on the ground to play with their grandchild, or they can't get up to go to work that day because the pain is so bad. And then they feel so terrible about the fact that they're always in pain mentally. It just keeps going around and around in a vicious circle. And so, yes, there are things out there that are non-addictive, non-habit forming, but the media has done a good job, and so has some of the constituents in healthcare, and even, unfortunately, I have to say politically, have gotten involved in some of these things that are not their place to be involved in. This is patient care. And when patients don't feel well, they need to have their voice or someone like us, through Affinity Patient Advocacy to step in to help provide them a voice so they have adequate care for them.
Agreed. They do. People deserve advocacy. If for nothing else, like you said, for them to have a voice. Because when you are battling a chronic illness and pain, it's very easy to lose your voice and become very overwhelmed in the process by itself. And there needs to be more, thought put to patient advocacy in every clinic, in every hospital. I know that they try their best, and I know that there's overcrowding. I don't want to not acknowledge that, but I think that the average person needs to understand where they can help and how they can help. And there to provide a supportive voice for the person who is battling, not just trying to talk about what's going on or the care they need, but they're battling the illness too. I think what I'm saying in short is that we could really do a lot better to help each other. But that's what we really truly work on, and I think that's at the bane of the existence of what we do as a board, is find a way to provide voice and support, because it's paramount. It really is.
Yeah, and the thing is that we understand the patient's perspective because we've been working with so many patients over the years, and they feel comfortable sharing with us how they're feeling and things that they feel that they need to share. They feel comfortable because we are not their nurse, their doctor. We're not any of those people. We're not their sister, their brother, whatever. We are just a group of people that are standalone advocates who are there to listen to whatever it is that they have to say. So they're inclined to share more information with us because we don't judge them. We don't complain about it. So in other words, we don't say back to them, oh, are you done yet? Do you have more to say? No, that's not, we truly are active listeners to these people, and we're empathetic, and we really try to see things from their side. We step in their shoes, which most people in professional situations don't do that. And so that's what happens. These people don't have somebody seeing it from their side. They just know the clinical side or the medical side or the healthcare side, the insurance side, the pharmaceutical side. They know all those things, but they don't veer into this side that could be uncomfortable for them, because now they're being told stuff that they should know, but they're choosing to kind of block out because they know what they know. And that's all they want to deal with is what they know. We're not like that. We know things, but we let them talk to us and tell us what it is that's bothering them. And how many long haulers have come to us that had mental health issues, and that has nothing to do with opiates. At one point or another, they were probably on opiates for pain issues and otherwise, but there were so many long haulers that have mental health illness issues that either they had prior or after, either they got COVID or they were taking the vaccines. And I'm not bashing the vaccines. I'm just saying this is what we've been seeing in our company when these patients come to us. So it's not puffery, it's not claims, it's a reality. We've been seeing it. We've had people that wanted to kill themselves. They were ready to do it. So thank God we got in there and we rolled our sleeves up and we stayed with them and followed them until we got them off that bad path that they were on that day, ready to put one in their mouth.
Right. No, I mean, you can't say enough for what I like to call the human side. And, just to take a step back to what you were saying before about, the doctors, clinicians, and facilities can offer a lot. They can get you out of an emergency situation. They can provide medication for pain. They can provide all sorts of insight into the body. But the one part that often gets lost because of the volume of usage is the human side. And that is the listening. That's the listening to everything that just went wrong in their day from sunrise to sunset. It's lending that time, but also the other side of what we do, because we are not clinicians. We're not boggled down with having to bring in patients and treat and diagnose. We actually can take the time to find different resources outside of a hospital or facility or your clinics. We can find different resources to help. Patients deal with a lot of things when they're chronically ill, starting with the illness, but it ends with who's making them dinner that day, who's picking up those groceries, who's grabbing the dry cleaning, who's doing the laundry, things like that. And we can find resources for patients to help, again, supporting that human side of illness. And see, when they're on medications as heavy as opioids and things like that, those are the first things to fall by the wayside. Self-care. Just the thing we take for granted. People need this support. Once they're on these medications, their self-care starts to fall to the side. They're not bathing regularly. They're not eating regularly. They're not hydrating regularly. They become dependent on medication. They're just ruled by medication. And I think that what we're saying here is that intersection is not only, it's deep and we can see it, but something needs to be done in order to not have folks who are chronically ill, maybe not mentally ill, fall into mental illness brought on by medication, brought on by opioids. This is why what we're slowly describing here is the crisis.
This
is the death.
And how about paying attention to the drugs they were already on? And I'm not saying drugs, illegal drugs. I'm talking about their medicines. Okay. Right. So let's talk about a patient that's taking SSRIs already for their mental health. They fall down, and now their doctor decides to give them opiates because of the pain, because the pain is so bad that now they need something to help with their pain. But at the same time, they also put the patient on gabapentin, which, for those that are out there listening to this show, we've talked about gabapentin and Lyrica and those drugs as it relates to diabetic neuropathy with both Dr. Donner and Dr. Ty. We have had them on when we were working on the DN study. We talked specifically about these. Gabapentin is prescribed for pain, inflammation, neuropathy. Those are the indications that have been approved for gabapentin. However, sometimes physicians prescribe gabapentin for off-label usage for anxiety. So let's talk about this. We have all these SSRIs. So for everybody out there, SSRIs are for mental health treatment. Okay, they're taking drugs already for mental health treatment. Then they give them opioids because they fell down and hurt themselves and they're in extreme amounts of pain. So they figure, let's give them that. Okay. Then we're also going to prescribe gabapentin at the same time. Okay. So that's supposed to be for pain and inflammation, allegedly, but we're already giving you opioids. That's supposed to be for pain, right? And you're taking all these SSRIs, and opiates counteract, in my opinion, with mental health drugs. And then you have this gabapentin you're taking, which you know that they use off-label for anxiety. Well, you don't know as a patient because it's not disclosed. They tell you it's for inflammation and pain. So you're taking all these. What do you think is going to happen to these people? Are they going to get off their bed from day to day? No, they can't get out of their bed anymore because they become depressed by all these things because everything is interacting with one another.
Yeah. The contraindications on medicine are not always the life-threatening immediate emergencies. Sometimes we have to look a little deeper and go for long-term. Ever been prescribed something and then prescribed something else to counteract one of the side effects of medication? That's another form of contraindication on medication for medicines. And I think that trio that you just described is one that is very detrimental because it starts to break down the mental state. The SSRI is there without, just so everybody understands, we uptake in our chemicals in our brain, we uptake serotonin. And sometimes when you have an imbalance, you will uptake it and then reuptake. You'll keep taking it. And what happens is you start to fall into depression, anxieties, and things like that. Well, what is SSRI is a serotonin, the selective serotonin uptake inhibitor. And reuptake inhibitor. And so it causes your brain to not continuously recycle these types of things. Now, that sentence I just said was a lot. That medicine alone is already doing a lot chemically in your body. And now adding on two others that have indications that can do similar things is a lot.
Mm-hmm.
And these things are worth talking about because this sits at the apex of most people's lives.
Yeah.
Women get prescribed those types of things more often than anyone else.
This was middle class. This is middle class. And this was my mom. As you know, Tiff knew exactly who I was talking about when I started talking about this, because I couldn't control this. And I'm the CEO of a nonprofit. And when I was talking to the physicians about getting her off the OPs, getting her off the gabapentin, they were resistant. I'm not a physician. I only had power of attorney. So I was handcuffed to what I was able to do. Folks, my mom died January 13th of this year. What's that say? Okay. So where's Tiff and I? Well, that's one of the reasons why we wanted to talk about this today, was because we had been working with my mom's case since March 24th of 2022, when I rescued her from the entrapment in the basement, when she was being trapped in her basement. And that will be, at some point, we'll talk about all of that on a podcast. But Tiffany being on our board, she immediately was tapped in. The entire board was working on my mom's case to help her get out of the mental health state that she was in. Could you imagine what she was locked in a basement in her own house in a dungeon and couldn't get out. And she's a mental health patient, bipolar. So, and then now we get out, we went into a mental institution, we got her recalibrated with her mental health. And then she's had several breakdowns, also a stroke. And then November gets Oxycontin codeine and gabapentin prescribed. Okay, guys, this was from March till November. This was my mother's life. Okay. Oh, and she had COVID in July. This all happened in this time period. And they decided this was a good idea. Why didn't they review the entire chart of this patient? And again, like we said earlier, put yourselves in their shoes and look at it from their viewpoint, rather than looking at it from your viewpoint, which is in your brain.
Yeah. Yeah, that's a lot. The spiral effect for your mother was rapid. And I think that bears a few sentences there. It was so rapid. It was almost as if you saw what was happening, but you couldn't see it coming. That rapid decline I think takes everyone by surprise. And before they know it, their life is in shambles, or a family member is watching another person's life go into shambles, and they're just like, whoa, scrambling. What do I do? And, again, why we need more advocacy, why we need more people stepping up and going, we need to figure out something else. And most importantly to me, as a patient advocate and activist for over 30 years, we need people to have freedom to choose. Freedom to choose therapies that may not be standard therapies, for folks to take a look at other medications, herbal medications, fungal medications, Ayurvedic medications,
homeopathic,
and make a choice. Because a lot of times people are presented with one choice. Let's be generous. 2 choices. Take this medication. Here's your prescription, or stay in pain. And the average person doesn't always know to look deeper, to look elsewhere. And let's face it, we've had campaigns, especially across the world, but especially in the United States, we've had huge campaigns against trying anything that wasn't a pharmaceutical medication.
Yeah, you're absolutely right.
They need the right to choose.
That's right. And then when there are drugs that are approved, from an FDA level, these patients, have the right to be able to get these through their physician and be prescribed these products that supposedly are supposed to assist, supposedly in the same sentence, sorry, It's supposed to assist them. And then it ends up kind of hindering because they're not always informed of the side effect profile. These elderly patients are not going to take a prescription packet, they're not going to take the prescription thing, read all of the documentation from the pharmacy that's pages long for their side effects. They're not going to do it. And even if they do, they're not going to understand everything because they don't have science degrees. So who do they call then? They get on the phone. Do they call the pharmacy? Okay, the pharmacists are under a lot of stress and pressure since COVID. They're still under those. I don't know about you, Tiff, but when I go to my pharmacy here locally, I sit in line for 15 minutes waiting for my prescription that I was supposed to be picking up because I was notified to pick it up then, and I can't even get it. And then when I finally get it, it's a quick 1, 2, 3, like birthday, da-da-da, what are you picking up? And out the door you go. And they ask you if you have questions for the pharmacy. However, you're in a drive-through. And even if you're there in person, it's the same shenanigans. So elderly people and other patients who are not elders that don't quite understand, they don't have the resources to be able to go, hey, listen, I'm concerned that my heart rate might drop or it might increase, or I might have, dry mouth, which thereby means I won't hydrate properly. Then I become dehydrated. All these things, just like you said earlier, becomes a spiral effect.
Yeah, it does. And that decline, I feel there's something that we can do about it. And so I know that my call to action, if you want to call it that, is to reach out to advocacy groups, reach out to us. But I like to be fair and go, if you're not going to reach out to us, reach out to someone and ask for an opioid crisis with a human being can be closer to you than what you think. It can be in your family right now and you don't realize it. So ask questions and reach out to someone to give help, even if it is just 1 hour a week, something, 1 hour a month. Every bit is useful. And we really need that human side. We need it. We need of it because this is a crisis. They say it on the news, you read it in articles in the paper, magazines, but we can't say it enough.
Absolutely right. As a matter of fact, I know you saw my post come up on Sunday from the Wall Street Journal, which was hard and fast, because for everybody out there, in case you didn't get to read this article, it talks about how Purdue Pharma, specifically the Sackler family, provided funding to a national level nonprofit organization that controls policies as it relates to healthcare. They've got $19 million over a series of about 6 years. I don't know exactly how many years, but for organizations like ours, Affinity Patient Advocacy, we do not accept money from parties that are involved in things that we cannot integrity line up with. So this obviously raised my eyebrows when I read that from the nonprofit sector, and also raised my eyebrows from the advocacy side of things, knowing that I had 2 family members, and my brother and my mother both suffered from abusing opiates. And so here it is again in my face. And they're talking about the fact that these guys are pay to play. And these guys, the other side, the nonprofit, was willingly accepting their monies. Well, what is going on here, folks? How could we write policies properly and influence policy if we're being paid off? So these are things that not everybody gets to read about. And it's our jobs to make sure we share this information with all of you guys. So that was one of the reasons why, again, we wanted to have this podcast in the spirit of mental health awareness coming up in the next, couple of days here. We wanted to make sure we connect it with you all so that you know that we're watching things and we're trying our best to put our foot forward to help patients like you out there.
Yes, indeed.
Ooh, that was, sorry. I get passionate about this stuff because it's stuff we talk about all the time. You guys, we talk, Tiff and I, and most of the board, we talk about these things all the time in just everyday discussions that we have that aren't always patient related, because these are things that keep us up at night. We worry about these things. So if there's ways that we can help you, you can reach out to us. And the best way to do it is just shoot us an email, info, info at affinitypatientadvocacy.org. If you have a problem that you think that we might be able to help you with, even if we can't help you, we will then try to find somebody who can help you, because we don't want to leave you high and dry.
That's right. We're trying for no patient left behind.
That's right.
All that really means is just reach out with anything. Just like Christina is saying, reach out, even if it is to ask a question. If you're not a patient and you're not suffering from anything, you just want to know more, please reach out to us. We'll invite you to a conversation. This is, we live and breathe this constantly. It is, for most of us, our way that we give back. It's the way that we pay forward. And we want to encourage everyone to do that. We're not elitists. We definitely, this is you, me, anybody. And anyone can help. So we'd ask that you reach questions if that's all you have.
Thank you, Tiff. And thank you so much for being on today and talking about this very important topic. We hit a lot in this one podcast, but they were all important things. I felt that we, and I know you did, because you kicked it off and then we just ran with it. So thank you so much for joining me today.
Of course. Thank you so much for having me back to talk about this.
Absolutely. So as we always say, remember, we are the same. I am Christina DiArcangelo. Thank you so much for joining us today.